Hello, everybody, and good evening, good morning, good day from wherever you're joining us from. My name is Dr. Vanessa Bokomokwe, and I'm excited to welcome you to Health Club Conversations today. Wow, if you're joining us today, it means that it's the end of the month, and we are here talking all health and leaving you to take charge of your health. I'm excited to have you here, and my speakers equally are more excited to have you here with me as well. Everywhere, no matter where you're joining us from, I don't want to be the only one here. So if you can just put in the chat box where you're joining us from, and we can gladly connect with you and say hi with you as well. And I just want you to know that today you're in for a powerful ride. I am excited that we are talking about all things health. And in the month of January, we're talking about cervical cancer. Cervical cancer. We've been going around with one agenda every woman must hear. And in this conversation, it is our hope and it's our desire that every single woman who listens to us will definitely be hearing. I see that Holistic Medic Network is here joining us. I salute you. It's good to have you here. Looking forward to an amazing time. We're indeed looking forward to an amazing time with you as well. Beautiful. Hi, Charlotte. Good to hear from you. Watching live from Florida, USA. That's beautiful. Our session is going global, is going international, and our conversation is going to be one that is going to be one for the books. Amazing. So, welcome once again. And today we are talking about cervical cancer. You probably heard about someone who just went to the hospital. She didn't know what was happening to her, and she was just told by the doctor that you are probably at the late stage of cancer and you're about to die. And it was all about cervical cancer. And the interesting part is cervical cancer happens to women. And I'm all passionate about women and health advocacy and making sure that you are able to take charge of your health. And so today we are here to save some women and snatch them from the hands of death and get them right into health. And to do that with me are amazing people who are well seasoned and well groomed, amazingly, to have us here in this session. And the very first amongst them is a passionate medical doctor, guys. And beyond being a medical doctor, she's passionate about women's health. And this has actually helped her to set up an NGO known as the Cervical Foundation. And what they do is actually to raise awareness, to advocate for proper resources when it comes to cervical cancer in very various remote areas. And they've been doing this for quite a long time. She's always loved the conversations around cervical cancer and inspiring people to foster that change. And I'm so happy she accepted to be here. She's actually a very busy person, so you can imagine. And she's here to not just speak cervical cancer, but speak health to you. So, ladies and gentlemen, help me welcome to the stage Dr. Kellen Nana Poku. Dr. Kellen, you're amazingly welcome to join us today. We are so happy to have had you. Welcome to our session today.
Thank you so much, Dr. Vanessa. It's a privilege to be here. I'm always excited when I'm called upon to talk anything women's health. So I'm excited to be here. Hi, everybody.
Hi, back to you guys. Right, amazing. So that's our very first speaker. You can even hear from her diction that we are in for a ride. And like I've always been saying, this is a conversation, so no pressure. You are actually involved to share your opinions even as we go on. Now, our second speaker is of the opposite gender. Of course, we cannot have an all ladies talk, but we decided to spice it up a little and invite our boy child or our male child. And he also is a medical doctor, the co-founder of Cervical Foundation. You know, that's really hits me hard. It's not all the time that you find a man who is passionate about cervical cancer and things about women. So really, I'm so happy that he's on board with this whole cancer awareness and making noise about it. Actually, one thing I love about him is that he loves health informatics. He loves health technology. And it means that our conversation is not just going to be about hypothetics, but he's going to bring those data-driven solutions to help us really appreciate how we can bridge the gap between health disparities and improve patient outcomes. So, without further ado, permit me to welcome to the stage Dr. Frank Ezra Kujo. Dr. Frank, we are happy to have you. Welcome. Thank you for joining us today. Dr. Frank, if you are speaking, we cannot hear you. So if you can kindly unmute, that would be great. Okay, it looks like Frank is having a bit of some challenges with his sound, but we'll hear his sweet baritone voice very soon. Those of us who have been patiently waiting to hear.
Hello.
Oh, yay, we got him. Hi, Dr. Frank. Good to hear your soothing voice.
Hi. I guess my audio works now. I'm audible, right?
Yes, indeed, you are.
All right. Hi. Thank you so much for the opportunity, Dr. Vanessa. Hi, everyone. My name is Dr. Frank Ezwa Kujo, and I'm passionate about transforming healthcare through technology, innovation, and advocacy. And I'm also the co-founder of Cervical Foundation Ghana, where we are working to empower women and communities with knowledge and tools to lead healthier lives. And it's a pleasure to share the platform with you, wonderful speakers. Thank you.
Thank you. It is a pleasure to hear from you and mix up the girly voices with a baritone voice. So we are happy to have you.
It's a
Right.
pleasure.
Finally, our next and last speaker is an amazing woman. I have known her and she does amazing stuff. She has over 11 years of working experience, guys. 11 years ago, where were you? I am thinking about it and I'm asking myself, where was I? Where was I? Probably thinking about how to write basic education certificate examination. But I just want to know from the comments 11 years ago, what was happening with you? Were you billionaires or buying plots of land? Well, we hear that very soon. But she has over 11 years of working experience and she's a medical doctor equally by profession. She's a specialist actually in lifestyle and wellness. We call her the wellness cheerleader. She actually runs a chronic care clinic where she empowers families with diabetes and hypertension to live healthier and happier lives. So that means that in today's session, we're going to leave here happy and healthier because we have our wellness cheerleader all on board with us. In her spare time, when she is not actively in the clinic, she mentors her residents, okay, to actually be all-rounded specialist. And she's involved in health advocacy, championing community outreaches and joining them. And it's her long-term goal to ensure that we are able to help people take charge of their health and live well at the end of the day. So at the end of the day, allow me to welcome to the stage Dr. Magdalene Mensa Bonsu Adakwa. Dr. Mandy, if you are here, we are glad to have you. Welcome to today's session.
Hi, Dr. Vanessa. Am I audible?
Yes, indeed, you are. We're good to see your lovely face. Welcome.
Thank you so much. And hello, Dr. Kaylin and Dr. Frank. Nice meeting you.
Magdalene, nice meeting you too.
Hi, Dr. Magdalene. Nice meeting you.
Amazing. I guess my speakers are ready, my audience is ready, and we are ready to set the ball rolling. Amazing. So today we are talking about cervical cancer, guys, and this is a shared conversation, including those of us in the audience as well. Really, before we get to the entry cases of the matter, what really is cervical cancer? Can you kindly let us know about it? And I'd like to start with Dr. Kellen. Kellen, can you kindly let us know what really cervical cancer is all about?
Okay, sure. Cervical cancer refers to the abnormal growth of cells on your cervix. And your cervix is actually the connection between your uterus, that is your womb, and your vagina. It helps ushers a baby from your womb, that is the uterus, to the vagina during childbirth. So cervical cancer is mainly cancer of the cervix. So cervical cancer usually develops as a result of persistent infection with the human papilloma virus. That is the wild or the high risk type. So human papilloma virus, okay, is the virus. There are so many strains of the virus, and the ones that have been associated with cervical cancer is HPV 16 and HPV 18. So HPV is sexually transmitted. So basically, when any woman who is sexually active, okay, gets involved in sexual intercourse, she has a high risk of getting infected with the HPV virus. And if after getting infected with the HPV virus, her body is not strong enough, or her immune system is not strong enough to fight the HPV infection, with time, the HPV infection causes the growth of abnormal cells on the cervix of the woman. And between 10 to 20 years, these abnormal cells continue growing and after some time develop into cervical cancer. So basically, that's how it develops.
Amazing. So if I'm to get you right, you're saying
Yeah.
that the cervical cancer is an abnormal growth in the cervix. And that means that guys don't have the cervix, so they
Oh,
probably might not have cervical cancer. And you also mentioned that what really causes that growth is the human papilloma virus. And I thought I
that's
had some mass. You were saying some 11 and 16, and if you can,
16. So there are
16 and 18. Great.
exactly there are of HPV, but the 16 HPV 16 and HPV 18 have been associated with cervical cancer.
Amazing. So we have HPV 16 and HPV 18 doing all the crazy things to our cervix and eventually letting us develop cervical cancer. Ooh, we need some police. Amazing. Right now, we have heard about cervical cancer. We've gone through what really causes that cervical cancer. Really, why is it dangerous? Why are we having this conversation? Why should I stop my tracks and get all of you on board? Why should my audience be paying attention to this conversation? What really are the statistics when we talk about cervical cancer? And Dr. Frank, I'll be glad if you can take us through what the statistics are when we talk about cervical cancer and how scary it could be.
All right. Thank you so much for the question, Dr. Vanessa. So, cervical cancer is actually a pressing health issue, both globally and locally, because looking at the global picture, it is the fourth most common cancer among women worldwide. And from recent statistics, in just 2022, there were about 660,000 new cases which were diagnosed. And out of that number, 350,000 of them died from cervical cancer. Now, alarmingly, 94% of all those deaths were from low and middle income countries due to limited access to screening and treatment. So, low and middle income countries like Ghana. And when you look at the local context as well, cervical cancer is the second most common cancer among women, just after breast cancer. And the recent data that we have shows that 2,797 women or were diagnosed with cervical cancer right in 2020. And out of them, 1,699 of them died. And so it's interesting to note that this disease disproportionately affects women living in rural areas who lack access to the right preventive measures. And as such, they really fall victim to the cervical cancer that we're talking about. And it's also important to note that in places where there's high HIV prevalence too, it exacerbates the risk. That is to say that with a woman or for a woman living with HIV, she is 6 times more likely to be infected or to develop cervical cancer. And like I already mentioned, because it also affects younger women, often women in their reproductive years, it actually has devastating family and cervical impacts. And for every mother who dies to cervical cancer, many children are left vulnerable, as you can imagine. And this increases the cases or the incidence of poverty and inequality in our communities. And that's why at Cervicare Foundation Ghana, we are addressing these alarming statistics by educational programs such as this, and also helping to provide subsidized screenings to underserved communities. Thank you.
Wow, like those were a lot of data out there, and I'm even like scared listening to you. Like 600,000 people, 1,600 women dying.
It's
That's
scary.
huge. And I sit back
Yeah.
and wonder, could this have been my mother? Could this have been my
Mm.
sister? For those of us who are yet to get into relationship, that probably could have been your girlfriend that just passed away, and not a lot is being done about it. So that's those stats are really alarming. And to know that we equally are in low and middle income countries, so that means stats are more alarming for us, especially
That's
those of
right.
us in the African continent. And a lot of things have to be done about it. I'm so glad that this conversation is being had so that we can actually have more insight and be able to stand firm when it comes to cervical cancer. Thank you so much.
Exactly.
But then again, I think I heard Kellen say that it is sexually transmitted, right?
Yes.
And sexually transmitted means that it's through sex. And does that mean that how will I know I have cervical cancer? Because like what are the symptoms? If I have sex, I have cervical cancer. Like, and I also heard you say it takes like 10, 20 years. So can you just brief me on how exactly cervical cancer looks like for a young
Okay.
lady or an adult female?
Okay, thank you. So the peculiar thing about cervical cancer is that at the early stages, it's asymptomatic. So as I said earlier, when a woman gets infected with the HPV virus, the virus causes abnormal development of cells on the cervix, and it takes about 10 to 20 years for the cancer to develop. So during this time, it is asymptomatic. So you may have the HPV virus. The virus would have caused abnormal cells on your cervix, but you would be normal. You would be going about your normal activities, and nothing. You would feel nothing. So most people, cervical cancer at the early stages is asymptomatic. However, during the late stages, that is when most women present with symptoms such as the most common being abnormal vaginal bleeding. And abnormal vaginal bleeding being bleeding outside your menses. So we all know women have their menses every month. But if you are bleeding, your bleeding is unusual. That is, you are bleeding more than usual. You are bleeding at times different from your normal menstrual cycle, or you are menopausal, but you are still bleeding. These are all termed abnormal menstrual bleeding. So any bleeding that is not normal, is a bit irregular, is too heavy for you, I think you should go see your doctor. Another symptom of cervical cancer is abdominal pain. So once again, our menstrual cycles come with abdominal pain. However, if the pain is a bit intense, more than usual, and you are postmenopausal, but you still are experiencing abdominal pain, I think it's a cause for alarm. You should go and see your doctor to make sure everything is okay. It's also associated with abnormal vaginal discharge. Once again, women, we have vaginal discharge. However, any discharge that is offensive, has an offensive smell, is copious. That means it's a lot compared to what you usually experience, or anything that looks a little funny. I think you should also go see your doctor. Now, when the cancer has progressed, then you will see symptoms such as weight loss, being the weight loss being unexplainable. That means that you have not purported, or you've not decided to lose weight, and you eat very well. However, you keep losing weight. That is called unexplained weight loss. And there's usually also easy fatigability. That means that you get tired easily. And there's also pelvic pain, and also swelling of your legs and everything. But this is usually when the disease or the cancer has progressed to its late stages. So the thing about cervical cancer is that it is asymptomatic. If you're a young lady, you are sexually active, you're not protecting yourself, there may be a high chance that you have the HPV virus, the wild type, and you may have cells on your cervix that may develop into cervical cancer. So that's what makes it a very preventable but also dangerous disease. Because it's asymptomatic, you may not know, and by the time you decide to seek help, it may be too late. So these are the symptoms of cervical cancer.
I feel like that's going to be very scary for it to be asymptomatic, guys. It means that it's not like I can get sick and I look like they've written cervical cancer on my forehead and I get to the hospital and the doctor will know. But the very fact that I can actually harbor the virus, the HPV virus, and even end up infecting a lot more people without them realizing. And that is very, very scary. I love that you were able to outline the various symptoms. I'll be glad if our audience can even outline it in our chat or our comment section so that we know that you're with us and you're actively learning. What were some of these symptoms that you heard from Dr. Kelling about cervical cancer? But I think I heard you say something amazing about the fact that women that are sexually active. So that brings me to my next question about risk factors. Risk factors. What really can put me at risk? So when I say risk factor, spoken about the causes. So the causes are what actually causes the disease. Now, risk
Yeah.
factors are things that actually increases your chances of getting the disease. Okay, so what really are these things that can increase our chances of getting the disease? Because I believe that if we know what increases our risk, we can reduce the risk. I believe you agree with me.
Exactly.
Awesome. So I would like you to share with my audience what these risk factors are so that we can be wary and guard ourselves. So in no particular order, if Dr. Frank wants to start, and then Dr. Kellen, you can add on. That would be great. Right. So Dr. Frank, over to you.
Okay, sure. Please, am I audible?
Yes, indeed you are.
Okay, so I think that's okay. So when it comes to the risk factors of cervical cancer, I think the first thing that we should take note of is being a woman, because women are the ones with cervixes. And so that's the most important risk factor that I think we all should know, because women are the most at risk of having cervical cancer. And that's why everyone should pay very close attention to it and not assume that it's something for distant people. The next thing is it also increases with, let's say, people who are postmenopausal, because it also increases with risk. As we know, all cancers generally have a higher, there's an increased risk of developing cancer in advanced ages. Now, the next thing too that should happen, the next thing that, or the next risk factor that I'll also talk about is, as Dr. Kellen mentioned, persistent HPV infection, because the more a person gets infected with HPV, the more likely that it increases the possibility of the cells developing abnormally to give you the cervical cancer. Also, as I mentioned, people living with HIV are 6 times more likely to develop cervical cancer, and this is because of the weakened immune system that people living with HIV who are not on treatment tend to have. So weakened immune systems too is also a very good risk. It's also a primary risk factor for developing cervical cancer, and primarily those, like example, like I mentioned, those having HIV, and also early sexual activity or coitus. If the age at which a person starts having sexual intercourse is really, the age is low. So I mean, people who start having sexual intercourse early, so maybe less than 16 years, they are more at risk of developing cervical cancer. Women with multiple sexual partners, or women who have a partner who has multiple sexual partners, are also at risk. And
I think I
these
love that point that you made. I love the last point that you made, that you said women with multiple sexual partners and
yeah,
women who have a partner who have multiple
exactly.
sexual partners.
Sexual
We
partners,
usually forget
exactly.
that point when we
Yeah,
talk about cervical cancer or cervical cancer.
true.
People go like, if you have more than one guy and you're sleeping with them, but guys, hey, you don't even know if you're a guy, you're a guy's girl,
That's
or
true.
if you're a girl's guy. It
Yeah,
can get serious like that. Like,
that's
how
true.
sure are you are the only one when it comes to you both of you being like all together and you are the love of my life, etc. I think February is coming, right? And so a
Yeah.
lot of people are on the game. But how sure are
Balance,
you that
protect yourself.
yeah, your girl's guy or yeah, your guy's girl? So
Exactly.
that's actually an interesting one. That's actually a first I've heard this, that
Oh yeah,
cervical cancer is not just about having multiple sexual partners, but
exactly.
the very fact that your partner can equally have multiple sexual partners.
Sexual
That's
partners.
scary, guys.
Exactly.
So
Yeah.
scary.
Yeah.
But I also love
And
another point that you made about the
okay.
age at which we have sexual intercourse. You said
Yes.
less than 16 years.
Yes.
And I'm scared because I think in our
Mm-hmm.
part of the world, in Africa,
Yes.
we are relatively more chaste. I don't know,
Mm-hmm.
but
Yeah.
globally, they tend to explore more. They tend to be more adventurous, guys.
Mm.
Yeah.
And how
Yeah.
come they are not having more cervical cancer than us? I'm wondering because in Ghana
Mm.
here, if I'm 16 years and I tell my mother I have a boyfriend, hey gosh,
Eh,
that's virtually like telling me to pack out of my house.
yeah. That's
But
true.
they do it so liberally, and I worry about age less than 16. Why are you exploring sexual behavior at 16 years? Isn't that
Hmm.
scary?
Yeah.
That
Isn't that
is.
scary? Right,
That is
right.
definitely.
Okay.
So
Kellen, is there anything you want to add on
okay.
to the risk
Yeah.
factors that has been mentioned?
Yes, please. Just want to add a few things to it. So basically, anything that weakens your immune system. So he mentioned being HIV positive or having the HIV infection and not bind to your antiretroviral drugs. Another thing too that weakens your immune system is diabetes, uncontrolled diabetes. If you have diabetes and you're not adhering to your medication, it lowers your immune system. And if you're a woman, it will increase your chances of cervical cancer. Also, women that are undergoing chemotherapy for any form of cancer, actually. So if you are undergoing chemotherapy, your immune system is weakened and it increases your chance of developing cervical cancer. Another research that has emerged is the long-term use of oral contraceptives. Yeah,
Okay.
has been associated with cervical cancer. So if you're a
Wow.
woman, you are on, maybe you started sexual activities early, maybe around 16, so you are on oral contraceptive pills to protect yourself from pregnancy. Maybe as you proceed in years, you increase your chance of getting cervical cancer. So that, and of course smoking, I can't forget smoking, not eating right, and not exercising. All these things sort of weakens your immune system or does not put your immune system at its best state. And so it increases your chance of the HPV virus developing into a cancer when you get infected.
That's scary because a lot of people are advocating for family planning, and they hearing that they being on family planning may increase their chance of getting cervical cancer can be threatening. But I see a message on the page about being a woman. Gosh. So today in church, my pastor was asking us why life is not fair. And one of the reasons that came up was that we didn't get permission to come into this life, and then we just ended up here. So extrapolating it to being a woman, we didn't get permission to decide that we become women, and then we ended up as women, and now we face this dilemma of being at risk of cervical cancer. So this is something we have to be wary about, especially as being women. Dr. Mandy, I see you're having a bit of some network issues. We see you. We are hoping to hear from you soon. If you can hear us and can't speak, would love to hear you. But if not, to humbly wait to hear your beautiful voice and your contribution to our session today. Right.
Dr.
Now we're
I
talking.
just correct something. So
Sure.
before, so I mentioned long-term use of oral contraceptive, right? So that
Mhm.
is a family planning method. However, there are so many other types or forms of family planning that is not associated with cervical cancer. So you can opt for those ones. So don't say because oral contraceptive pills have been associated, you are staying away from family planning altogether. No, please. We don't want to do that.
I thank you so much for chipping that in because I was coming to tell you that my audience is coming to beat you. What if I'm like, I have like 10 children and I want to go on a contraceptive and you're telling me that oral contraceptive. So, guys, OCPs are just the ones that we've learned today are course. So, you can go on any of the others, okay? Don't continue to become gravida 11 para 10, please. I beg you. For those of us who understand that term. Right. That's beautiful. I think I had one risk factor, and I just wanted to ask that somebody said multiparity was a risk factor. I think I even heard it in. Can we explain to the audience what multiparity is and if we know how that equally translates into cervical cancer? Right.
Okay, sure. So multiparity is basically having multiple children, that is from five and above. So if you're a woman and you have five children and above, you are called a multiparous woman. And I think the reason why it has been associated with HPV is because if you have, I think if you have more than five children, it means you have your sexual encounters are more. So that means that your risk of getting the HPV virus is also high. I think that's why multiparity or having a lot of children has been associated with cervical cancer. But if anyone has an idea, you can also
Right.
add up.
Dr. Frank, do you want to add on to this conversation about multiparity and cervical cancer?
Hi,
Hi.
am I audible?
Yes, indeed,
Yes.
you are.
Okay, sure. Thank you. So, in addition to what Dr. Kellen said, so yes, one of the main things or reasons why multiparity or having multiple full-term pregnancies would lead to an increased risk of cervical cancer is because of the prolonged exposure to HPV. Because when women have multiple pregnancies, they have increased exposure or risk of exposure to HPV, assuming that the multiple births are from multiple sexual partners. So that's one thing, not just any form of multiparity, or if, like you mentioned, the partner that they have or the partner that they have who they are having children with has multiple sexual partners. Second thing is during pregnancy, there's also immune suppression, like we mentioned. Highly immune, when the person has low immune state, it's highly likely they may develop this cancerous mechanism. So that's also another factor. And also, we know that there's also trauma to the cervix during pregnancy, and the repeated trauma to the cervix increases the likelihood of abnormal cell production or abnormal growth at the cervix. And also, I think finally, too, the hormonal changes that occur during pregnancy make a person or a woman or the cervical cells more susceptible to the effects of persistent HPV infection. So these are some of the other reasons that contribute to multiparity being a risk factor for cervical cancer. However, not a really strong risk factor, I must add.
Right. I think I love that. When we talk multiparity, once you have like two, three children, and grand multiparity when you have more than five children. And I like that you mentioned that there's trauma. I like that you mentioned that sometimes, most of the time, in our parts of the world, it's because of different partners. That's how come you have a lot more children. So that equally plays a role in our risk of getting cervical cancer. And I just wanted to say that, like you mentioned again, it may be a risk factor, but probably may not be a very strong risk factor. And it's so funny because last time when we had health blog conversations, we're talking about how we should take a break from some of the sexual activity and actually fast. And the men were on my neck that I'm asking them to fast off their wives, you know, as part of setting their health goals. And I'm here again, once again, telling them that please, after four children, guys, family planning method or take some periods of fast, okay? You guys shouldn't come for me in my DMs, but it helps reduce the chances of getting cervical cancer. Right. So if you're joining us for the very first time, this is Health Blog Conversations with Dr. Vanessa, and I'm here with my amazing speakers who are helping me talk about cervical cancer. We've spoken about the general understanding of it, we've spoken about risk factors, and right now we are about to delve deeper also into some of the screening and early detection methods so that we'll stay armed. I'm happy that you are still joining us and you are through and through. Right. So, Dr. Frank, if you can, one of the major things I heard about cervical cancer was HPV.
Yeah.
HPV. HPV. How effective is HPV testing? Or even as you mentioned it, what are some of the ways that we can actually test or find out or look out for cervical cancer in a woman?
Okay, thank you so much for the question once again. So for looking out for cervical cancer in a woman, there are screening tests that are done. There are a number of them, but what is available here in Ghana? So we have the HPV testing, that's the human papillomavirus testing or screening. We have the pap smear, and we also have the VIA, that's the visual inspection under with acetic acid. And these are some of the main ways of screening for cervical cancer. We can also take swabs, endocervical swabs or samples, and then investigate them under the microscope. So these are the main ones that I know are available in Ghana. There are so many more. I think I'll just limit it to these three.
All right, thank you so much. And Dr. Kellen, can you take us through who should actually be vaccinated? Is it just anyone? Can my 6-year-old girl go get vaccinated? Or if I'm 80 years, should I go get vaccinated? Who qualifies for vaccination and HPV testing? Basically, that, yeah.
Okay. So just a quick one. I just want to touch
Okay.
on this. So
Okay.
for the cervical cancer screen, as Dr. Frank rightly said, we have the pap smear and the HPV and VIA testing in Ghana. And ideally, anyone from age 21 to 65, they're supposed to have a cervical cancer screening done every 3 years. That is anyone from age 21 to 65. However, if you have early sexual debut, that is, you started having sex early, then it means you would have to start going for the screening earlier than the age 2021. Now, going back to the vaccination, the HPV vaccination research has said that it can prevent up to about 70% of cervical cancer cases. And that is actually one of the key weapons, if I may use, that the Western worlds are using to combat cervical cancer. So in the Western worlds, as soon as their children clock 9 years, they, as you mentioned, they are more liberal as compared to us. So they make sure that as soon as their children clock 9 years old, they give them the HPV vaccine. And what this vaccine does is that it sort of prepares the system so that when you get infected with the HPV virus through your sexual activities, your body will fight against the HPV virus better so that it does
Okay.
not develop cervical cancer. So, according to the WHO, children between the ages of 9 to 14 years should be given the HPV vaccine. And the HPV vaccine, the ones available, at least in Ghana, we have Cervarix and Gardasil. And ideally, you need 3 doses for you to be fully vaccinated. That means you need 3 doses of the HPV vaccine for you to be fully vaccinated against HPV. So I think that's it about the vaccine. It should be between it should be your age should be between 9 to 14 years, or any age that you have not had a sexual debut yet, because the vaccine is effective when you are not sexually active. So we assume that from age 9, is ideally no child should have had a sexual encounter. So that's why WHO sets the age for HPV vaccination from 9 to 14 years. And it's available in Ghana, guys.
Thank you. We'll talk more about the vaccine very soon, but I've seen a lot of questions coming in, and we just want to hear from our audience how they feel, what they are thinking, and also answer them. If you're joining us, this is Health Plug Conversations once again. It's an ad hoc of the Health Plug Network. And here at the Health Plug Network, we help individuals take charge of their health with the right information and with the right community as well. A partner of ours is called Carrium Care. Carrium Care offers remote counseling for busy lives who are trying to juggle the hectic schedule of supporting themselves through growth and relationships. So if you're looking for a counselor to help keep your mental health at bay, kindly contact the number on the screen for personalized counseling, guys. Mental health is important. You definitely want to take charge of it. Great. So our very first question from the audience is from Eunice Abba Abedu Sam. She's asking that, are there specific diets or health recommendations that can lower the risk of cervical cancer? Dr. Mandy, if you are here and you can speak, oh, okay, she just left. All right. Okay, so to any of you, our speakers, are there any specific diets or health recommendations that can really lower our health risk of cervical cancer? Dr. Frank, do you want to take this?
Okay, that's fine. So when we talk about cervical cancer, I don't want us to forget that it's mainly a type of cancer, and as such, There's some general risk aversion methods or things that anyone should bear in mind in a bid to live a healthy lifestyle and avoid the risk or chance of developing any form of cancer whatsoever. So, not notwithstanding, there are no specific meals that have been linked with the development of cervical cancer, but I can speak to healthy dieting habits that can help you avoid cancers altogether. And that includes maintaining a healthy diet that are rich in fruits and vegetables, fruits that have a low amount of, reducing intake of foods, highly processed foods, and avoiding the use lifestyle things like Dr. Kellen mentioned, tobacco, smoking. Those things increase the risk factor or your risk of developing cervical cancer. And so there is an eat well there's an eat well guide for how to maintain healthy diets. If you look it up online, you can find the amount or the proportions of food parts that you should have in your meal. And I think once you're on those diets, you shouldn't worry much about the healthy diet component, but maybe focus more on the more determining risk factors like family history and other ones that we've mentioned. That's it for me.
Thank you. Thank you. So, no specific diet exactly, but healthy eating, veggies, fruits, cutting down processed foods, no sausages, no bacon, and staying fit, basically. We get you. We've heard you. We'll sign up for the gym very soon, guys. Right. So, Bernard is here. Bernard is saying that prevention is better than cure. We should get vaccinated and we should stay safe out there. We've heard you, Bernard. We'll do that. We'll do that. And I have Mr. Kwesi York, one of our amazing elders. He says he's enjoying the session, especially the names of interesting parts of women. Hey, Kwesi, please, oh, we are on holy grounds, right? And he's saying that, yeah, I think it's to my sexual activity comment that if men should take a break, where will Christian men go? Please go to heaven, pray and read your Bible and get closer to the Lord, right? So this is him to his question. He's saying that his question is, growing up, he heard that women who engage in sexual activities are highly prone to cervical cancer. Is this true? Is this true? Kellen, if we can hear from you.
Yes, please. As we mentioned earlier, HPV virus, which is the main cause of cervical cancer, is sexually transmitted. So, yes, women who engage a lot in sexual activities, unprotected sexual activities, are prone to getting cervical cancer.
Right. And he has a second question specifically for you. I don't know why Kwesi has given specific questions for the lady doctor, but he says that he assumes that women in Christ are free from this, especially those who keep themselves from early sex. He says those are his assumptions. Is he right? And he wants the lady to answer. Please, my lady, are his assumptions right?
Yes, please, your assumptions are right. As a woman in Christ, you're supposed to keep yourself. However, you are not very, you are not 100% sure the man you are going to end up with if he had a past. And you know what I mean by he had a past. So, he may have had a lot of sexual partners and you are the one keeping yourself, but he will come and infect you. So that's just the downside of that. However, if you keep yourself and you make sure you and your future partner, or if your future partner also keeps himself, your chances of getting cervical cancer are very, very low. So yes, keeping yourself is a very good preventive measure against cervical cancer.
Hallelujah to our women in Christ out here. If you're a woman in Christ, holla us in the comment section. We are keeping ourselves and ensuring that we are free from cervical cancer. Big ups to everyone else. Dr. Magdalene, if you are here, we want to see your face and hear your voice. We really have missed you. Are you around? Right. I'm sure she's still trying to get on board and get us on board. Right. We have another question from Mr. Roberto Agini. He's saying, what's the cost of the vaccine? The vaccine that we mentioned. What is the cost of the vaccine?
Okay, so the cervical cancer vaccine, as I mentioned, there are I think three on the market now. We have Cervarix, Cervarix 4, and Gardasil 9. And it's pretty expensive actually. And unfortunately, the government, it has not been added to the national immunization scheme for things to be a bit subsidized or smooth for us. So unfortunately, you would have to pay out of pocket for the vaccine. And the last time I checked, it was between $250 to $750 per shot. Yes, and you need three shots
Wow.
to be vaccinated. So it's very expensive, very, very expensive, unfortunately, but it's worth it, I guess. So that's the cost, between $250 to $750 per shot, and you need three shots to get vaccinated. So you can do the math.
I like that you want us to do the math because I don't think I want to calculate that exchange rate here. But that's crazy. How, if the government really is not supporting us, how are we encouraging people to actually purchase the vaccine? I also have on grounds that the vaccine in the Ridge Regional Hospital is about, I think, 950 Ghana cedis. So that's
Oh,
for
okay.
per shot. Per shot. So
Okay.
if you have some money, you can start saving. Save like you are saving for the rest of your life and do get it. So it's actually very good. Is I would advise you to do that. I know other places like Mary Stopes and others also do give it for about 1,000 Ghana cities. I'm not here
Per
doing
shot.
publicity, but per short, yes. So to be good that you start saving maybe part of your salaries for some point to do get the vaccine, and that would be a good thing to do. Right.
Okay.
So
All right.
once again, this is Health Law Conversations. Frank, do you have something to share with us? Frank, if you are speaking, I cannot hear you.
Is it better?
Yes, I can hear you now.
Okay. So I was saying that for anyone looking to get a shot, at Cervical Foundation Ghana, we're working to partner with the service providers of the vaccine across the country. So you can reach out to us, and the near future, we are looking at making the prices very, very affordable and subsidized so that everyone can get vaccinated. So that's also something I feel like we should all know.
That's so beautiful. I wish I could just clap out here to Cervical Foundation Ghana. I'm so glad you guys came out here to do this, and the advocacy game is great. And thank you so much for thinking about our pockets as low and middle income country members and citizens and putting this in there for us. I believe this would really save a lot of us and encourage much more of us to get vaccinated from cervical cancer. Amazing. There's another question about lifestyle changes. I would have loved that Dr. Magdalene will answer this because she's the lifestyle and wellness expert. So we'll come back to you, okay, Abba, and answer your question. Right. And Patience is asking that, yeah, that's crazy. I know I'm even feeling all crazy about the amount of money, but hey, right. So she's saying that how can the average Ghanaian get vaccinated then? I'm asking myself the same question. Hopefully, the government can start doing some advocacy. We'll talk about advocacy very soon in getting these vaccines available for us at subsidized areas. Okay, so our last question, and then we'll go back to our conversation. If the vaccines are meant for individuals who are not sexually active, how then can sexually active people be prevented for getting the HPV infection and ending up in cancer? So I think we have a pilot program in Ghana about 5 years ago where we vaccinated children 9 to 14 years. Okay. It ended in 2018. And from 2018 till now, we've not heard much about it. But her question is, if we are saying the vaccine is for people that are not sexually active, what about children who are sexually active? How are they going to get prevented from the HPV vaccine? So that leads us to our next line of conversation, which is what are some of the preventive measures we can put in place to help prevent us from getting cervical cancer? So, Dr. Kellen, if you can take us through.
Okay, and thank you very much. So, let me just answer her question real quick. So, for people that are sexually active, you can't get the vaccine because it will not be very effective for you as compared to someone who is not sexually active. But what you can do is to get screened. As I mentioned, every 3 years, you go to the hospital, you get your pap smear done. Pap smears are actually quite affordable as compared to the vaccine. There are different types: the pap smear, VIA, and HPV testing. They are all screening methods for cervical cancer. And I know personally that Marie Stopes clinic offers the VIA, which is very cheap, it's 65 cedis per that's for the VIA. So, and for the cryotherapy, I'll come to that, it's 250 cedis. So it means that if you're sexually active, you just walk into Marie Stopes with 65 cedis in hand. And of course, any regional hospital around you, I don't know the prices there, but I'm sure of Marie Stopes. You walk in there with your 65 cedis or 100 cedis max, then you get your cervix checked. So you do this every 3 years to make sure that you do not have the HPV virus. And if you have, it has not developed into cancer yet. Now, for the preventive measures, basically the prevention is screening and vaccination. So if you're sexually active, go for screening every 3 years to make sure you are okay. And if you are not sexually active, you go for the vaccine. So you get all the 3 shots to be fully vaccinated, and of course protect yourself. I am an advocate for abstinence, but if you cannot, please use a condom, protect yourself. You may be very careful, but you're not sure who the person that you are going into that with has been with, so use a condom if you cannot abstain. And basically all the risk factors we mentioned. If you are smoking, please put a stop to it and eat well, exercise, and all that. Basically, those are preventive measures that you can do to protect yourself from cervical cancer.
Thank you so much for sharing these preventive measures. I love that you're an advocate for abstinence. I'm here again, advocate for abstinence, guys. Elder Kwesiya, please don't come for my head. But if you can't, the BC are always available for you. Be faithful to your partner, be your partner's partner, single partner, guys, and no one else's. And condom use also can help because it's sexually transmitted. But we're talking about conversations about finances, and we've spoken really about how financially tedious the vaccination can be. What about the stigma? Well, what I think like I had last 2 years, sorry, had the opportunity of working on the breast cancer project, and we're speaking to some of the women diagnosed, and one of the major issues they had was the shock of being told that they had cancer and the stigma associated with it. You know, people think that when you have cancer, you're gonna die. But let's talk about the stigma. And as we delve deeper in the stigma, Frank, can you let us know the stages of the diagnosis of the cancer? And then you speak about the stigma associated with the cancer. Dr.
Okay,
Frank.
sure. All right, thank you. So I'll start with the stages. So there's cervical cancer has stages of progression. So not to make it too technical, I'll group it into early stage and late stage. So early stage will be anywhere from stage 1 to stage 2, and late stage will be stage 3 and stage 4. Notwithstanding, there are precancerous lesions, which are called the cervical intraepithelial neoplasia, or it's before it develops into a cancer, right? There are so many changes that occur in the cells of the cervix before it becomes visible. And that's why when Dr. Kellen was talking, she made mention that it takes from 10 to 20 years for the cervical cancer to become visible. And that's because during that time, it's developing inside where it's not so visible unless samples are taken from the cervix to be visualized. And so there is that's the precancerous lesions before the stages where the cancer has started developing, where we have the early stage, that's stage 1 to stage 2, and the late stage, that's stage 3 to stage 4. That is it for the classification. And for the stigma, I must say, like you mentioned, when anyone hears the term cancer, they think it's a life sentence or a death sentence, which is really not true because out, that is a big misconception because that misconception was developed from our local circumstances because late detection and diagnosis reduces the risk of survival or the survival rate. And as such, most people are diagnosed later and most of them end up dying, not because cancer killed them per se, but because the diagnosis was made later on during the course of their disease. And so that is one thing that really propagated the stigma surrounding the cervical cancer and any other cancer for that matter. And also, there are so many cultural barriers that color the stigma that surrounds things and procedures like gynecological examination. Many people believe that some of these procedures performed at the hospital and some of these procedures that are done as screening methods actually contribute or have adverse effects, and as such, there's this whole stigma around going in to be checked, going in to be sure that you have cervical cancer, as well as some false religious and cultural beliefs about as long as I am this, I'm here, I'm this, I'm really really free from having cervical cancer, as long as I'm insert any assumption here. So all these things actually affect the stigma and contribute to the stigma surrounding cervical cancer.
Thank you so much. I love that you mentioned that our culture color our stigma. And that is really a profound statement, to actually hear. And it's sad. I think culture is meant to bond us, it's meant to unite us. But here is a case where culture is separating us or disuniting us, especially in a fight against cervical cancer. And to any woman listening to me who has ever been told she has cervical cancer or feels like she's at risk, or you probably are listening to us and you've had so many sexual partners, you're worried about the fact that maybe it may be true. I want you to know that we support you, we hold up to you. It actually starts with us, our little steps in letting you know that it's not the end of the world. There's always
Yeah.
something that you can do about it. And it's when you seek that early care. I'm always in about cancer like this, that early detection saves lives. When you seek that early care, we can help you. And it's amazing that cervical cancer has a cause. It's one of the very few cancers that actually have a cause. And so it can be prevented in about 90% of people. So if you come early, just like malaria, we can find a cure for you. All right. And that being said, let's talk about some of the treatment options available. Dr. Kellen, if I found that I'm having bleeding that is not in regular tandem with my menses, I'm having very offensive discharge, I've lost weight aside from the stress of work, I've lost like some substantial amount of weight, and I go to the doctor, I get tested, they do an HPV testing, or they do a VIA for me, and it comes out like I have cervical cancer. What treatment options are available for me? What can they do for me?
Okay, thank you for the question. So, cervical cancer treatment, um, the mode of treatment is based on the stage of the cancer. So, as Dr. Frank said, we have the precancerous lesion, that is the CINs. We have the early stage and we have the late stage. So, for the CINs, that is the stage where the abnormal cells have developed, but they haven't become cancerous yet. With those stages, we have the treatment option for that stage is cryotherapy and laser therapy. So cryotherapy, yes, please. So cryotherapy is pretty easy and very affordable. That is why early detection is key. So when you go during your normal pap smear test or your HPV testing, and you realize that the doctors realize that there are precancerous lesions on your cervix, they just have to use cryotherapy. Is using very very low temperatures, okay, so like almost like ice, so very low temperatures to sort of cut out cut out the part of your cervix with the precancerous lesion. And sometimes they also use laser to treat that. Then we have the early stages of cervical cancer, where the cancer has spread from your cervix to maybe your uterus. That is kind of early, so that one is usually surgery. So with that one, they take your cervix, the part of your cervix that has been affected by the cancer. And if your uterus is also affected, unfortunately, they would have to take out your uterus with surgery. And then, of course, give you some chemotherapy and radiotherapy to burn the tiny cancer cells that will not be taken out with surgery. And the last one is the late stage. So the late stage of cervical cancer, as I mentioned earlier, is when the cancer has spread from the cervix, has even gone past your uterus, that is your reproductive organs, and has even gone to your lungs, even your brain, sometimes your bones and your liver. When you are in this situation, unfortunately, the treatment is palliative care. That means that the cancer has spread and there is very little that can be done. And so all that the doctors can do for you is to give you supportive care, to give you fluids, give you pain medications if you are in pain, just to make sure that you are not suffering. However, the cancer has progressed so much that there's very little they can do to actually save your life. That is why early detection is key to preventing cervical cancer.
Wow, that's quite an extensive and comprehensive submission. I like that we can actually do cryotherapy in the very early stages. And thank you so much for sharing on the treatment option. I think it gives hope to people that are listening that are already scared of all the things that we are saying, but they can see light at the end of the tunnel. If you're joining us, we are almost an hour into our talk. I didn't even realize because we've been having fun. This is Health Blog Conversations with Dr. Vanessa, and we are talking about cervical cancer. I'm here with Dr. Kelling and Dr. Frank and Dr. Mandy, but she's having a bit of a network issue that she'll join us. Right. Another note from one of our sponsors is asking that if you are looking out for honing your talent or skills with the right mentor, then you want to join the Legacy Excellence Mentorship Program. It's happening this February from the 4th to the 27th, and they are doing wonderful things there. If you want to contact any of them down there, you can, and you would be in for a wonderful journey with the mentorship program. Great. So back to a bit of our questions. because we are here for our audience, and then they are going to enjoy more if we are able to get them in. Someone is asking something about the myths, and that's what will dive us into the myths about cervical cancer. She's saying that she has a wrong use of herbs, especially those that are inserted into the vagina, can cause cervical cancer. How true is this? If I insert herbs into my cervix or into my vagina, do I also stand a risk of getting cervical cancer? Right. Who would like to help us? Dr. Frank, do you want to help us with this?
Okay, so that's an interesting question. So I can't speak for the herbal part, but I can speak for the trauma to the cervix, as I mentioned with the issue with the multiparity. So if the insertion of herbs, and I genuinely don't even think herbs can get as far as the cervix, but you never know. So
You never
yes, so
know, my dear.
you
You
never
never
know
know. You
what
never
kind of
know.
herbs the person is talking about. Yes, so I would really recommend. Okay, so let me speak about that myth. So I think that the most important risk factors are what we have outlined. So the family history, persistent HPV infection, and all of that. However, anything that you introduce from the outside into your vagina or your, into your into your vagina has an increased risk of giving you an infection, has an increased risk of giving you, in fact, so many kinds of infection, which may contribute to developing not just cervical cancer, but other, adverse health conditions. So I don't really recommend doing that unless it is by recommendation of a professional health care provider. Or, if you are someone that you like alternative medicine, that's also okay. But make sure that you're under strict supervision and guidance and you know exactly what you're doing. But the most important thing when we talk about the cervical cancer is making sure that you're free from all the risk factors that we've spoken about and you're doing your due diligence to ensure that you are screened. Because if you already started developing precancerous lesions, it really isn't about the herbs or anything you do. It's about making sure that you detect it early and then the right measures are taken. So that's what I would say about that.
I think I agree with you because, first of all, I think we mentioned that cervical cancer is sexually transmitted, right?
Exactly.
But if there's anything that can contribute to its transmission, so we've been talking about how it's been salient, it's silent. So
Exactly.
maybe you already have the cervical cancer, you insert, you have some trauma, you're contributing to its growth. Long
Exactly.
term infections, long term weakening your immune system, you are
True.
encouraging it to really work well on you. So directly, no, maybe herbal medicine may not, or inserting may not, but long term, yes, it actually can worsen or increase your risk of getting cervical cancer with that school of thoughts. But guys, why are you inserting into your vagina? Ladies and gentlemen, I'm here to plead on behalf of all the women advocates. Your vagina is sterile. It takes care of itself. Okay, not like it's sterile, but it takes care of itself. Okay, as much as possible, limit the introduction of things into the vagina unless you're having like penile vaginal intercourse. But don't be putting or inserting things in your vagina. It's not healthy and can lead to a lot of adverse reactions or adverse situations. Okay. Right. More on the questions. Okay, I have a question here. It was about the vaccine. The person is asking that is there an age cutoff for the vaccine? Or can women at any age get the vaccine? I think I heard you say 9 to 14. What if I'm 30 years? Maybe I'm not sexually active yet because I'm a woman in Christ. Can I also get the vaccine?
I think so far as you're not sexually active, you can go for the vaccine. But children from 9 to 14, research backs that is more effective in such people. But if you're older and you're not sexually active, why not? You can go for the vaccine.
Thank you so much. And our next question is what role do safe sexual practices play in prevention of cervical cancer? And that's in tandem with a question I got before the session. The person was asking me, hallelujah, we sanctify this meeting with the blood of Jesus. Do sexual practices or sexual roles or sexual, I think it's sexual positions rather, play a role in getting cervical cancer? Yes, I think that was the question. So if we can also address it for those who are adventurous here on our session. Yeah.
Okay, I don't. so. I don't think sexual positions contribute to cervical cancer. I think any sexual act that involves the male genital getting into the female and increases your chance of getting infected with the HPV will get you will get you will lead to cervical cancer. So I don't think the position matters. So far as the penis is getting into contact with your vagina to transfer the HPV virus, you're at risk. That's
Right.
what I think. But
Right.
sorry, I
Thank
just wanted to answer the safe sex. So the safe sex is basically protecting yourself. So wearing a condom, of course, it will protect you from the HPV virus. So leading or preventing cervical cancer. So yes, that's how safe sex prevents cervical cancer.
Right. Thank you so much. And
Welcome.
Frank, do you want to tell us about any of the myths you've heard surrounding cervical cancer as a healthcare professional and a cervical cancer advocate? What are some of the myths that you've heard, and what is the truth behind those myths?
Okay, thank you for the question. So, I think commonest thing you hear with cervical cancer myth is I don't have any symptoms, so I don't need screening. And if you've gotten anything from this session, you should know that's not true. And that's exactly one of the main reasons why cervical cancer is a public health concern. Because, like we mentioned, the early disease is mostly asymptomatic, and that's why regular screenings are crucial for early detection. And the second one that I'll speak about is that it's incurable. Many people think, as we mentioned during the talk about the stigma, that when they have cervical cancer or when someone has been diagnosed with cervical cancer, it is a death sentence. And that's not true. That when detected early, cervical cancer is highly treatable with excellent survival rates, and which we already mentioned that early detection does save lives. So those are two of the commonest misconceptions I've heard. Yeah.
Right. Thank you so much for addressing those. There's another question. Is there a way to treat the HPV in men so that the spread of the virus is limited? Yes, we said men don't have cervical cancer. They don't have a cervix, they can't get cervical cancer, but men can spread HPV. So is there really a
Yeah.
way to treat this HPV in the men so that they do not get this virus and or they spread the limit?
Okay.
Dr.
So I
Kellen.
think in Yes, please. So I think in Western countries, that's one thing. Once again, one of their weapons for fighting cervical cancer is that they are blessed with a vaccine. So they even vaccinate boys in addition to vaccinating their
Okay.
girls. Yeah. So
Wow.
boys aged 9 to 14 who have not had any sexual debut are given the vaccine in Western countries so that they are protected and they do not get the virus and transmit it to women. So they are sort of killing two birds with a stone. They're protecting, well, the boys, okay. So the thing about HPV is that HPV 16, okay, Dr. Magdalene is in.
Dr. Magdalene, we're happy to see you. We have our smiles out here. Hi. Okay.
I don't know if she can even hear us.
Oh, yeah, I think she can. Right, right.
Okay.
Dr. Magdalene, we can't really hear you. Right. Dr. Magdalene, we cannot hear you. Okay. Dr. Magdalene, if you can't hear me, we cannot hear you. So maybe you can check on the settings and ask Helen wraps up. Right.
Me. So as I was saying, they protect their men and they also protect their women. So the thing about HPV is that HPV 16 and 18 cause cervical cancer. However, other strains of HPV can cause other cancers like anal, throat cancer, and all other types of cancers. But it's cervical cancer that we make a lot of noise about. So in Western world, they vaccinate both boys and girls. And in doing that, they kill two birds with a stone. That is, they protect the boys from the other strains of HPV that cause other cancers. And they also protect their women because the boys will not be able to transmit the HPV to their women for them to develop cervical cancer later. So one thing we can do is to vaccinate not just girls but for boys. But here's a case where in Ghana, even the girls are struggling to get the vaccine. So I think considering boys being vaccinated is not in the near future at all, I think, for us as a country, because we've not even established protecting women to talk about boys. But boys can be protected with the vaccine. That's the only thing that can protect them. Yes, please.
I agree. I agree the vaccine is good. I also agree that if you were a guy here, you have penile discharge and you have some itchiness, you have some rashes, you have multiple sexual partners, you notice any of these symptoms, there is a likelihood that you have a sexually transmitted infection. And I can imagine how stigmatizing or how uncomfortable it would be going to the hospital and meeting beautiful ladies like Dr. Kelling and telling her that, Doctor, please, I have a rash or I have a discharge and all that. I've had men, I'm always proud of the men who come to the hospital and see me and share those complaints. But be bold and then go to the hospital, get tested. We run some tests, get treated. Because if you're able to get treated from a sexually transmitted infection, you won't be able to spread it. Okay, so that is an important contribution I just wanted to make. Once you notice you have a symptom that looks like a sexually transmitted infection, don't sit on it. Don't go and drink, quote unquote, some herbal medication that may or may not help it. But as much as possible, seek early care and let's make sure we safeguard you. All right. A contribution from one of our medical doctors who was answering Dr. Belinda's question on whether men are free from HPV. And Dr. Nkrumah says that men are not necessarily free from the vaccine, from the effects of HPV, that while men may be free from cervical cancer because they don't have a cervix, they are at risk of other cancers like penile, anal, and oropharyngeal, which was rightly said by Dr. Kelling. And that also informs the positions that people make a lot in their sexual activity. So please, you might be at risk of other cancers, maybe not necessarily cervical cancer. Thank you so much, Dr. Nkrumah, for that contribution. Kellen, do you have any myths that you want us to debunk before we get to ending the show and wrapping up? Yeah.
Sure. I think the one that I get often is that the pap smear or the cervical cancer testing, the HPV testing is painful. I want to debunk the myth that it is not painful. It is not supposed to be painful. It is uncomfortable, of course, because it's an invasive procedure. However, it is not painful at all. If you are experiencing any pain during the process, you'd have to quickly alert the nurse or whoever is conducting the pap smear for you. But ideally, pap smears, VIAs, all the other cervical cancer testing are not painful. They are quite uncomfortable, but not painful. And I think the other one that I get is cervical cancer hereditary? So someone reached out to me and she was worried because her grandmother and mother they both died of cervical cancer, and she was a bit worried. So as we mentioned, there hasn't been research that has linked cervical cancer to genetics. So like if you have a mother or a sister who has developed cervical cancer, it's not genetic, so you will not develop it. However, if you protect yourself, you practice safe sex, and then you protect yourself from all the risk factors that we've spoken about, you are likely to protect yourself from cervical cancer. So I've not read anywhere that cervical cancer is hereditary. Maybe future research will link it to genetic makeup, but I know it is not hereditary from the information that I know.
Right. Thank you so much for bringing that on board. And I think we mentioned about what the government is not doing to help females when it comes to the vaccine. Really, let's talk about policies and advocacy. And my question to you, Kellen, will be that what can the government do really to help cervical cancer awareness, advocacy? And to Frank, after Kellen is done, what can religious bodies and schools also do to contribute to this fight? I personally love that you have a foundation for that. But this is you outside the government. So, what about the other people on ground? What can they do? So, let's hear from Frank about the schools and the religious bodies. And we hear from Kellen so that if there's a member of parliament or if the president is listening to us, which is not far fetched, he can actually help get policies and advocacy on board. So, Frank, over to you. Frank, I cannot hear you.
Hello, thank you so much for the question. Am I audible now?
Yes, indeed,
Yes.
you are.
All right, sure. Thank you. So, like you mentioned, outside of the government, schools, workplaces, religious institutions, they are trusted community hubs, or I would say points, that can help drive, let's say, awareness. And there are a number of ways they can do this. I'll start with religious institutions. As you know, many Ghanaians are religious, and that means that somebody is more likely to belong to a religious group. And as such, religious leaders can really, really drive the awareness programs that we are talking about, and they can help the fight by raising awareness, by including it as part of their messages, or making time for experts to come talk about cervical cancer to their women and men in general. I would give an example. Recently, a church reached out to us, that Cervical Foundation Ghana, to come give a talk at their what's his name, a women's meeting, right, to help promote cervical cancer awareness. And it was such a pleasure to get there to, talk to them and then build and empower them about what cervical cancer is all about. And that is one way that we can empower, or the religious institutions can empower women, or their members in general, to promote cervical cancer awareness. And it will wonder you to know that we have an upcoming screening program at their vicinity, just because they were willing and they were opening to partner with us to help screen the people in their church and in the community at large. So as you can see, the community is benefiting from that initiative by that church. Also, when it comes to schools, as you know, we mentioned that the vaccine has been proven by research to be very, very effective. I mean, in certain age ranges. So, like Dr. Kellen mentioned, 9 to 14. And these are people, school going children. And that means that if schools would, integrate cervical cancer awareness programs or campaigns or education into their curriculum, not necessarily to make it part of the things they teach, but if they can make time to allow foundations like ours to come around, educate the children, let them know where and how they can get vaccinated. And like we mentioned, we subsidize the vaccination plans, and it makes it very, very easy and affordable for them to get vaccinated. They become empowered right from that early age to take action and become very, very aware of their possibility, or the work they can put in to reduce their risk. These women or these girls can tell the women in their lives, including their mothers, their sisters, and it sort of ripples like that. And so when we started out, so it's also something that we do, and we do not take very, very lightly as a foundation, educating schools around the country to ensure that as many people as possible are aware of the cervical cancer. And finally, I'll touch on the workplaces. So organizations can offer, on-site screening programs, wellness days. They can help provide employees with, resources, information, and also encourage regular health checkups. And I think that would go a long way into help make up for that gap which has been created by certain things that are not available, like national screening or vaccination programs. And it will really, really drive the efforts, into making sure that no woman dies from cervical cancer, which is the aim of our foundation, Cervical Foundation Ghana, Cervicare Foundation Ghana. Sorry. Thank you.
Thank you too. I actually agree with you. And for those who want to know, Machimota Hospital is running free cervical screening, sorry, for women, about 200 women. Okay. So the end of the month, we have like 4 or 5 days to end the month. So try as much as possible to pass there. Those of you who live around Kolebu as well, Kolebu is offering the first 100 women vaccine at a 50% discount, which is 100 Ghana cities. After the month of January, I think you can get a screening, but it probably would be around 200 Ghana cities. So make use of this free vaccination. If you are in Kumasi and you're listening to us, the KNUST in conjunction with the International Papilloma Virus Association Society, also are giving free screenings to women in Asia and I think Swami. So please take advantage of these opportunities and let's make sure that every single woman is being heard, is being helped, and is staying safe. Now to Kellen, speaking to our MPs and our ministers and our president of global and continental heads of state, what do you have to say about policies when it comes to cervical cancer?
Okay, thank you very much for the question. So, one of the reasons why the Western world is winning the fight against cervical cancer is because their government really take the fight against cervical cancer very seriously, and unfortunately, Ghana is not winning that fight. But what is not too late, the government can still do something, and they can do things through three main ways. So, for awareness, they can organize cervical cancer awareness campaigns, TV shows, talk shows that promote cervical cancer, because most Ghanaians have not heard of cervical cancer, especially those in the rural areas. So, district assemblies, metropolitan assemblies, municipal assemblies, the health coordinaters there can organize free like cervical cancer awareness campaigns to make sure people know about cervical cancer, and this can be sponsored by the government. What they can do concerning screening is to subsidize screening in all the health centers, that is the regional hospitals and municipal hospitals all across the country. They can also offer free screening, partner with NGOs like Cervical Foundation Ghana to offer free screening to women. And the last thing they can do is that they can partner with global organizations to offer free screening to girls. And as you rightly said, I think in 2017, they piloted that where over 200 girls were vaccinated. However, I do not know what happened for that policy to be stopped. But I think the government can take it up again and even add it to the national immunization scheme. Just as we know, if you are born, you have to get a BCG vaccine as a baby. If possible, the government can add the HPV vaccine to the immunization schedule, that every child who turns 9 should get the HPV vaccine. That would be a very wonderful initiative, and it can help prevent over 90% of cervical cancer. There are countries like that have really fought against cervical cancer and are on their way to eliminating it completely from their country, exactly because of some of these initiatives. And of course, certain organizations like Cervicare can contribute. However, we cannot do everything alone without the help. So I urge anybody in high position who can get the ear of any big man, any big woman in government, that they should really take this seriously and help the country fight cervical cancer. Thank you very much.
Thank you too. And I believe that any politician or big man that heard you will be happy to add this on board for the propagation of a good campaign for cervical cancer and ensuring that less people have that condition. And just a quick one, guys. I think I mentioned that Kolibi was doing for the vaccine. Please, it's for the screening. It's 100 CDs for the screening, just to get that out there. I see Dr. Magdalene has joined us in the chat section. Thank you so much. I'm so sorry about your network issues, but she says that one of the major myths she would like to debunk with us is that someone goes like, "I'm married as a virgin. I never got myself involved in any early sexual activity. Hence, I'm exempted from getting cervical cancer." Answer is yes, but we should remember that your partner could also put you at risk, especially if your partner has a high risk sexual behavior. So, the surest way to be safe is to get regular screening and testing done. Thank you so much, Dr. Magdi. Dr. Mandy, if you are here, could you help us answer a question from one of our audience? She was asking about lifestyle changes that can help prevent or reduce the risk of cervical cancer, and we'll be glad to read it out to her. Right, what are some of the lifestyle changes that can reduce my risk? And we would be glad to answer that. We have someone in the comment section who would like to reach out to Cervical Foundation, guys, to help make this advocacy possible in their schools. So, Mr. Aloysius, if you'd like to reach out to them, I think you can have them on LinkedIn. I would give them
Yeah.
the opportunity of sharing the contact and any other means of reaching out so that you can easily contact them and they would be there to help you reduce that risk of getting cervical cancer among the ladies before we end. Okay, another misconception from Dr. Magdalene is saying, "I'm doing just fine. I have no symptoms now. So why should I worry about cervical cancer?" Dr. Mandy says that precancerous lesions and cervical cancer usually develop slowly, and it takes about 10 to 20 years. And so, unfortunately, the symptom of most women for cervical cancer is asymptom, no symptom. So, cervical cancer is asymptomatic. That's why we need regular screening at appropriate intervals to ensure that it is done right. Great. We are almost at the end of our conversation. It's been a whooping 1 hour, 30 minutes, and I've enjoyed every single bit of it, from learning about cervical cancer to debunking some myths to having you guys join the conversation to laughing it out and finally speaking to community and advocacy. It's been a wonderful ride. I just want to give you the opportunity, guys. And before we wrap up, what one advice do you have for one woman listening to us after hearing about cervical cancer? If both of you can just share an advice, that would help. Yeah. So let's start with Dr. Frank. It's been a while I heard the man's voice. Yeah.
That's perfectly fine. So I want to let you know that cervical cancer is preventable. It is treatable and it is beatable if you detect it early. And I would advise that you take all the necessary steps to get screened and to get involved with every treatment regime or, you know, procedure that has been outlined for you. So all these things that this awareness campaign, like this, a conversation we're having, it's to the end that you would know so much about cervical cancer, and you would know that so much can be done about it. As we mentioned, early detection early detection leads to prevention in about 90% of the cases of cervical cancer. So go to that hospital, do that screening test, follow up on that result, get to your gynecologist, make sure they know what the results were, and I mean, be very, very serious about it to know that you're truly free, and not just for yourself, for all the women in your life. Make sure that everyone is safe and free from this. I call it this cancerous burden, because you might be safe, but if a woman in your life is not safe and dies from this, I don't think that's something that any of us would really want. So please take the initiative and make sure that you're doing all that you can before it's too late, because there is time.
Thank you. Let's make cervical cancer treatable
Yeah.
and beatable and preventable. I like those. Preventable, beatable, and treatable. The PBT. Beautifully said. Please, can we hear from you, Dr. Kellen? What are your final words to a lady that is hearing us talk about cervical cancer? I think you're muted, dear.
Thank you very much. So my advice to that lady watching me is that I know the discharge from your vagina, the bleeding from your vagina is scaring you at the moment, and you are shy to talk to somebody about it. But trust me, going to the hospital to seek care is one of the best decisions you can ever make in your life. So go to the hospital. If anybody you love has complained to you of these symptoms, abnormal vaginal bleeding, offensive discharge, take them to the nearest hospital, and it could be the best decision you could make to save their lives. And if you have a child between the ages of 9 to 14, I know the vaccine is quite pricey, but if you save, you can do it. So just vaccinate your children who have not had their sexual debut yet, and you be, if even if the person is a boy, you'll be protecting him, you'll be protecting his future wife and his children from cervical cancer. Thank you very much.
Thank you so much, Dr. Kelling. It's been so great having you guys here. I've learned a lot. I believe my audience too has learned a lot. I just want to spotlight our most active member. She is Dr. Med Belinda Doe. She's actively been listening to us and putting down salient points in the comments. So, Dr. Belinda Doe is on LinkedIn. You can follow her. She's also a medical doctor and a health writer as well. Thank you so much for joining us and helping our audience with the salient points. We appreciate you. Right. And before we leave, we just want to give you the opportunity to spotlight yourself. How can we reach out to you? What do you do? So that my audience can easily know who to go to when we need something. So let's hear from Dr. Kellen. Who are you? What you do? And where we can reach you. Same for Dr. Frank, and a little bit about your Cervical Foundation.
Okay, thank you very much. As you know, my name is Dr. Kelly Nanapoku. I'm a medical doctor and I'm a women's health advocate as well. I'm also the co-founder of Cervical Foundation Ghana, and you can reach out to us. We are more of advocacy, creating awareness on cervical cancer screening, cervical cancer vaccination. We have a lot in store for you, some free screening programs and some vaccination programs coming along, which would really require your support. So if you see Cervical Foundation, or if you see my face or Frank's face anywhere asking you for money, please do not ignore us. Kindly contribute, and you'll be saving the life of someone somewhere. Thank you very much. And of course, our social media platform, Cervical Foundation Ghana. The Ghana is very important. You have to add it to find us on all social media platforms, and you can find me on LinkedIn, Instagram, and LinkedIn and Instagram, Dr. Kelly Nanapoku, and let's connect. Thank you very much.
We'll definitely connect with you. We want to hear your lovely self and see your lovely face. Dr. Frank, over to you. Where can we find you? How can we find you? What can you help us with?
Okay, so hello everyone. Once again, I'm Dr. Frank Ezwakujo, and I'm passionate about transforming healthcare with technology, innovation, and advocacy. So I'm also the co-founder of Cervical Foundation Ghana, and we are working together to improve and empower women and communities with knowledge and tools to help them lead healthier lives. And beyond my work in advocacy with Cervical, I'm also deeply involved in health technology, where I'm building solutions that leverage AI data and digital tools to make healthcare more accessible and efficient. So we're starting here in Ghana, and we're aiming to expand across Africa and beyond. And at the core of everything I do, I believe innovation and collaboration can, solve some of the biggest challenges we have in health and global health. So it's quite a pleasure to be here. I'm excited to be here today to share insights and to learn from this conversation. And if anybody has any wonderful projects in any of the areas I've mentioned, please feel free to reach out. My name is Dr. Frank Ezwakujo on LinkedIn. I'm also available on all social media platforms. And if you're also looking at the work, you can find the work we're doing at Cervical Foundation Ghana, mainly on the social media platforms, especially on LinkedIn. If you'd like to get involved, we will soon be rolling out, giving chances for people to volunteer with us. And if you'd also like to invest, like Dr. Kellen was saying, please do get in touch, and we'd love to have as many people as possible joining us in the fight against cervical cancer. Thank you.
Thank you
Thank you,
too.
Dr.
And before we end, okay, a moment, please.
Hello.
Before we end, we just want to answer a question from the comment section. Dr. Magdi has been able to help us. She said the lifestyle changes can help reduce your risk of getting cervical cancer. Practice safe sex, use condoms, and stay faithful to your partner. Ensure you're eating a well balanced diet, mainly made up of plant based diet and veggies, fruits, and nuts, which contain vitamins and antioxidants. Stay hydrated, at least 3 liters of water daily, and take nature walks to manage your stress. Thank you so much, Dr. Mandy, for being a part of this event from the comment section. We've loved having you. You're definitely coming back again because we want to see your face and hear your voice. And we would have to have your signing up message as well in the comments. Before we end, I think Dr. Kellen wanted to share something.
Oh, yes. I forgot to mention that I'm a graphic designer. Yes, I own my business called Golden Touch Designs. So if you'd want us to design anything from flyers, logos, wedding invitations, and T-shirts, you can just find us on Instagram for now, Golden Touch Designs, and we can do it for you. Thank you.
Amazing. Thank you. We'll definitely be coming to get our designs carved out. My name is Dr. Vanessa Bokumokwe. I'm a medical doctor, public health advocate, and a public speaker. So if you're looking for anyone to help speak on health at your various organizations, in your church, in your community, you can definitely reach out to me. I'm also the founder of Health Plug Network, a community of people who are championing taking their health seriously by ensuring that they are in tandem with challenges. Right now, we are having our 3 liters challenge for the month. It's been quite a roller coaster, people struggling here and there, but knowing that you have a family who are appreciating the challenges as well has been a good thing. If you want to join the network, feel free to reach out to me on LinkedIn at Dr. Vanessa Bokumokwe, and I'll gladly help. I also mentor healthcare professionals. So If you want to find a personal brand, get right on LinkedIn, learn how to public speak, I'll definitely be there to help you out. Thank you so much for joining us. And we are so glad to have every single one of you from YouTube, from LinkedIn. We appreciate you. We love you. Till next time, same place. This has been Health Plug Network with Dr. Vanessa. Bye, everybody.
Bye.
Bye.